if you were up for it, I could even do a demonstration, very blind to
Please.
therapist demonstration with you, Emil, if
Oh,
you want to.
I would love to do that.
This is
Yeah,
high
let's.
stakes. I always do this in my trainings. I do, get a volunteer therapist, and what we do is, I'll ask them if they've got something they'd like to work on, but they don't necessarily need to tell everybody. They might do,
Mhm.
but they don't have to. So we do that blind to therapist because, again, people don't know what's going to happen to the recording, and they might not want to talk about something.
Mhm. Mhm.
So anyway, it's not necessarily a high risk strategy, but it wakes me up. It'll wake me
Um,
up now because
no, I'd love to do that just to give our listeners a bit of an idea of how this could look like.
yeah,
So are you asking for me to come up with a bit of a target to begin with?
yeah, and the only thing, and it can really be anything. You don't obviously have to share it.
Hmm.
And if you were to think about it, I probably don't want a sub 10 target that's
Hmm.
really, but just but again, we could work on it. The other thing is we want something that's kind of a bit standalone would be helpful rather than something that's
Yep.
part of a pattern. Um,
Yep.
but again, yeah. So anyway, has something come to mind,
Yeah,
Emil,
yeah,
that you'd like to
something's come
work
to
on?
mind. I can locate a target.
Uh-huh. And if you were to know, and again, I don't want you to really bring it up, think about it too much, but if you were to know how to stressing out of 10 it was, where 10 is the worst and naught's nothing, what kind of number would you give it?
It's hard for me to say because I have the image, but I don't have a significant uh,
Emotional charge.
distress. But it brings out a sense of sadness, a real sense of sadness, and a like it's one of those memories of like I did the wrong thing, and
Right.
and there's nothing that I could do that's going to change what happened. But
Uh-huh.
it feels like it's a very cognitive thing, but a
Does
big
it
sense
still
of
feel a bit
sadness.
like but it still feels a bit like it's your fault?
Yeah, yeah.
Okay. So again, this is a really interesting situation. So in a clinical situation, I would probably default to EMDR processing with this because, and this is why Flash and EMDR are very complementary because there are not high levels of emotion associated with this, but there's potential interlinking. There's a sense of I'm responsible, I did something wrong, and there's probably some body sensation, and it's kind of something that needs to be opened up a little bit to resolve. Um,
Mm,
and even the fact that it's the levels of distress are relatively low, so that would be very amenable to EMDR processing. Um, Whereas with Flash, it might have an effect, it might not have an effect. I'm quite happy to give it a go,
le-
so to speak. The benefit is we're not going to there's very little chance, there's no chance of any harm happening in this situation because we're not opening it up. And what I say is that Flash is far less dangerous than a poor history tape. If that makes sense. A
mm,
poor history tape where someone opens up trauma, but too many trauma boxes all at once is terrible. And it's one of the the issues I find with maybe people who maybe just recently trained in EMDR and they kind of oh, we're phase one history taking. That's what we do. And they kind of somehow forget they're a therapist. You got to be. People drop out and don't come for trauma therapy because it's painful. You're asking people, even telling you their history, to touch a hot stove. So you've got to be really sensitive to all of that, which is why I like Flash, because the minute anything looks tricky for anybody, I then might use the Flash technique just as a way of bringing it down, bringing the distress down. Which, of course, if you're doing this in session 1 or 2, the client is kind of they start trusting you. B, they sense immediately that this stuff that they thought could never change can change, and and you're just building confidence and hope right from the very start, which is so important with trauma work. And if you just launch into okay, give me your life history and all the shit, it's just not good. Anyway, so going back to what you suggested, what you've brought. So again, when the trauma is really high level, you don't push it at all. But with what you brought, we need to push it a bit to kind of open it up. We need to make it a bit more malleable, if that makes sense. So I wouldn't. This is not an example. This is not a demonstration, if you like, of using a flash technique with a very intense memory. So okay. So when are you comfortable or not sharing what the thing is? This doesn't really matter either way, but
probably not.
Then that's fine.
Okay.
Then leave it at that. So the question is, so when you think about this event, was this something that happened when you were much younger or as an adult? Again, just to help me contextualize it.
When I was in my 20s.
Okay. And so when you think about that event now, what's the kind of the worst part? Is it the image? Is it the body sensation? Is it the emotion? Is it the thought fucked up or mucked up? Apologies for swearing on your podcast.
No, you can do that. Be yourself. I think it's I'd done something, and then someone's seen me, and then I just realized how shitty that thing was. And so I know that this is very vague, but then it's like,
no, it's crap. Fine. This is fine. So when you think about that now, what are you noticing in your body right now?
There's a lightness in my legs. My legs are getting lighter.
Yeah.
I'm noticing it was almost like pressure that's coming in my head. My hands are getting a little bit sweaty.
Okay, and the thought, I screwed up. Okay. So that's kind of, and if you had to give, I know you struggled to give it a number, but if you had to give a number for the whole thing about how bad it feels now, the distress of it, where 10's the worst, 0's nothing.
I'd say it'd be something like a 5 or a 6, 5.
Okay,
nothing.
5. Yeah, 5 or 6. No, that makes sense. Okay. So what we're going to do, we're just going to put that all over there, and we're going to just chat about something that you find interesting. So what kind of hobbies have you got, Emil? Or maybe you could tell me about your children, who are probably your number one hobby in terms of time. Or
I recently wrote a kids book, and it was
okay. Let's just pause there.
Yep.
So we're gonna just have this chat. When you hear me say the word blink, I just want you to blink 3 times rapidly, like that, literally like that.
Yep.
Okay. And we'll do that. We'll chat for a bit. So anyway, but before we do that, just go back to what we started with, the thing that happened in your 20s, and I just want you to kind of bring that back into your awareness one last time before we put it over there. And so, tell me, what is this book about?
Well, Blink. It's called Caspian and the Zombified.
Blink. Remember when I say the word blink, and it might feel like I'm interrupting you. I should have said that.
Yeah.
So Caspian and what? Sorry,
3
blinks. Yeah, but just like that. Yeah.
Okay.
You can do it as quick as you can, but it doesn't matter. But
all right.
Yep. Okay. Yeah. What was the book called, Emil?
Caspian and the Zombified Gastropods. And
this is not a textbook. This is not a
this is a story,
no.
It's a kid's story book that my oldest son's name is.
Yeah, that's it. Your oldest son's name is. I know it feels a bit clunky, but don't worry.
No, that's okay. My oldest son's name is Castiel, and so the characters in the book are a play on my 2 kids' names. So Castiel and Micah. There's Caspian and Michael in the book.
Blink, yeah, cool. Okay, you can go a bit further. It doesn't have to just do it as a little flatter. You don't have it's
okay.
It doesn't matter too much. It feels like you're trying really hard to follow my instruction.
Yes. I feel like I'm blinking hard.
Don't worry.
And so the book was originally written for them, and then I just wanted to get it out there as well, because I thought it'd be a pretty cool story to share with others.
Excellent. When did you publish it?
It's coming up, so within
Blink.
Yeah. I did the blinks quickly. Okay.
I know it's all a bit strange. So let's just take a pause. So let's
Yep.
just take a pause from this. Let's just go back to what you started with, the thing that happened in your 20s. And then just tell me if you notice any change, yes or no, overall. Don't feel compulsed to say yes. It may feel less distressing further away, or there may be no change at all.
Is probably a slight change in terms of intensity. Probably a one or so
maybe drop down.
drop.
Okay.
Yeah.
So just look at what's the worst part of it right now in your mind.
I think it's progressed a little bit, so it's not stuck to the original image that I had. It's more progressed to another area of that image, of that memory.
Okay. So let's just again put all of that over there, and tell me about some of the other books. How many books have you written? You sound quite prolific.
I've written a few. I think 5 in total.
Yeah. And which one's been your bestseller?
None of them. So I have a problem with marketing. So
okay,
for me, I love to write, and then when it comes to getting the word out and advertising and all that sort of stuff, that's not my strong point. So I write because I enjoy it, but it's still yet.
Well, that's right. You're getting the word out now, which is great. And so okay, and and a mixture of fiction and non-fiction by the sounds of it.
Yeah. I've been writing since I was a little kid. It was in a way it was my escape from some of the tricky things in life. But yeah,
great. Okay. So let's just take a pause there again. And I know it does feel a bit artificial, and it does feel like I'm interrupting you. I probably should have said that right bit at the start, but because that can be a bit off-putting for people. But there's a good reason, because we're kind of interrupting what's going on inside. Inside. So again, let's just go back to what happened in your 20s and tell me if you notice any more change there. And again, it might be quite subtle, because I said at the beginning, we're not dealing with the typical thing I'd be dealing with.
Well, I feel like it's continued to reduce. Again, the memory is progressing in terms of what had happened. And now I'm starting to think more about the positive things that I've been speaking with you about.
Almost as if that's coming in front of it.
Yeah, that's kind of coming in front. That's what I'm noticing.
Good. Well, look, that's probably an okay place to stop it, and you just got a sense of the process. Now, of course, if so I literally did this yesterday with someone that had witnessed a fatal incident right in front of them, and you can imagine that the content of that is very, very distressing, and it has the same effect. In fact, it had a quicker and a more dramatic effect. In fact, the first time I ever did this was with the prison officer who'd opened a door and found something pretty horrible. And the first set of the blinks we did, when I said go back to what you started with, he was doing this. He kind of, I can't get it. I can't get that anymore. Now again, I've seen that before. It wouldn't, but that was still quite very dramatic. And all the distress associated with that image went. And in the morning he woke up and it was still the same. It had gone. Wow. And that's why it's a game-changing event.